Our goal at Ridgewood Talks has long been to celebrate the leaders and legends of the village. And now we feature the best of Ridgewood business leaders. Ridgewood Talks and Ridgewood Living Magazine present the Business Spotlight, hosted by Jeanne Johnson.
Hey everybody, welcome to Ridgewood Talks. Today, Dr. Annemarie Olson is joining us, and she's the founder of Sophisticated Hearing right here on Maple Avenue in Ridgewood. And Dr. Olson has been helping individuals with hearing loss since 2001. She is deeply committed to her practice and has served on the Hearing Loss Association of New Jersey's Board of Trustees since 2008. And Dr. Olson is also the Vice President of Communications for the New Jersey Academy of Audiology. She received a Doctorate of Science degree in audiology from Montclair State University, where she is also an adjunct professor. And during her graduate studies, she held externships at various hospitals in the New York and New Jersey area, and has a supplement to her studies. Dr. Olson has presented her research findings at international conferences on auditory processing in young, middle-aged, and older adults. You can probably hear from my voice that I am suffering from allergies at the moment, and my ears are stuffed up, so this is a perfectly timed guest to the show. So thank you, Dr. Olson, for being here. We really appreciate it. First of all, let's start off by saying that you are a guest writer for Ridgewood Living Magazine. How long have you been writing for the magazine?
I believe I've been writing for them for about 3 years or so.
Oh, wow. That's amazing. Good for you.
Thank you.
And you also have a wonderful blog on your website, which,
Thank you.
What's the address of your website?
www.sophisticatedhearing.com.
Great. All right. So talk to me about Sophisticated Hearing. When did you start the practice?
I started the practice from scratch in 2005, so we're celebrating our 20th anniversary this year.
Congratulations. That's a
Thank
big
you.
deal. Have you always been at that location?
No, we just moved to this location about 3 years ago. We were previously in a much smaller location in Hohokus.
Oh, okay. That's why. Well, I see it. So what's the address? It's
Our current address is 531 North Maple Avenue in lovely Ridgewood.
right. So those of you who are driving between Hohokus and Ridgewood, you'll see this beautiful white building
Thank
with
you.
black accents, and it's really a really pretty building. So talk to me about the name. How did you come up with the name?
So before I opened the practice, I actually worked for another hearing aid practice. And as I was working with the patient, someone just said, this hearing aid technology is so sophisticated, sophisticated hearing.
Gotcha.
So I definitely have to give tribute to a former patient who inspired me with the name Sophisticated Hearing.
Well, I like it. It's really, it says a lot too. It says, this is not, a lot of times people, if they are experiencing hearing loss, I feel like there's shame attached to it. Right? Is that so?
Yeah, there can be. There's sometimes a social stigma that if you're not hearing well, or if you're wearing hearing aids, you're getting older, you're not with it, you're not as young as you used to be, you're not as sharp as what you used to be. And unfortunately, that is so far from the truth. Someone who has hearing loss and either may not be aware of it or may not be addressing it, they might lean in a little bit more. They might say what. Oftentimes, they might have difficulty with turn taking. So you might be having a conversation with this person. If I'm not hearing you, I might ask you something that you just spoke about or answer something inappropriately. So in my opinion, finding out if you have hearing loss and treating the hearing loss, typically with amplification or some other type of intervention, can really help someone to stay young and active and vibrant. And I have so many patients who say, I can't believe I waited this long. I really should have done this sooner, because it brings back that communication, that self-confidence, that ease of relationships with your family and loved ones.
Oh, for sure. I can say that. So my sisters, both of my sisters have hearing loss. And my older sister, she just kind of pulled herself away from all of social interaction because she said it was so frustrating for her because she couldn't hear.
Right.
And when she would have to ask people to repeat themselves, then, I do this too. So I probably have, some hearing loss as well, but if I'm in a noisy place, I'll go right up to somebody and I will talk into their ear. So I want them to hear, and I want them to do the same thing to me. And for some people, it's really off-putting. So
Right.
I can understand why people would want to remove themselves from social settings, especially if it is a crowded place. So what are some of the symptoms, aside from obviously not hearing? What are some of the other things that people that suffer from hearing loss? What are some other things that are associated with that?
So some common things is you may want the TV to be louder compared to someone else in your home. You might go to a restaurant and say, oh, that restaurant's too loud, or so-and-so didn't enunciate. Everybody mumbles more often. When someone has hearing loss, especially in the earlier stages, it's not that you can't hear, but speech isn't clear like it used to be. You think people aren't enunciating. So it's very common because hearing loss tends to occur very gradually. It's an invisible condition. I can't look at you and see if you have normal hearing or hearing loss. It's not like you might have a cast on your arm. And also it's a painless condition. So we don't really think of our hearing.
Right.
We take it for granted.
Start blaming everybody else.
Correct.
For
So
mumbling.
you think, oh, so-and-so, the waiter, didn't project their voice. The restaurant was too loud. There was a crying baby behind me. And we come up with excuses naturally as to why we had difficulty hearing in that particular environment.
Right.
And we may not realize that it's happening more and more.
Right.
And it's also very common that other people realize you have difficulty hearing before the individual realizes.
Right. I think it's important for people that if they have a hearing loss to just start off the conversation with that, right?
Correct.
And we talked earlier about some of the issues that people were having with COVID, with masks, and how many of us, expound on that a little bit about how people recognize facial cues.
Yeah, so we had a huge increase in people coming in for hearing tests, especially at younger ages. During COVID, because everybody was wearing masks. So you go to the grocery store, the bank, the restaurant, wherever it was, and other people were talking to you through masks or through plexiglass. And a lot of those people came in, they did have normal hearing, but when you don't have those visual cues, when you don't have that reinforcement, if someone said sat versus hat, you don't have that lip reading cues that we just do so naturally, people thought that they were having difficulty hearing, and the reality was your brain just wasn't getting as much information visually as well as auditory or through the ears.
It's just amazing how we rely so much on non-verbal cues too. So let's talk about what age should somebody come in and get a baseline hearing test, and what is involved in the baseline test?
So everyone, regardless of age, should have a baseline hearing test. Any baby that's born in this country goes through a newborn hearing screening. It's especially important for children to be tested to see if there's any risk for hearing loss. Even a mild hearing loss in one ear can put the child at a disadvantage for incidental cues.
So let's just pause there for 1 second, because is that part of the APGAR test when a baby is born?
It's a different screening.
Okay, it's a different
So it's outside of the APGAR test,
Okay.
but it is a mandatory screening in the United States.
Okay, good. All right. Well, I think it's right, like you said, it's very, very important for those testings to take
Correct.
place at birth. And then if there's, I know that they do hearing testing at schools typically.
At schools
right?
and in the pediatrician's office, because there are some conditions where a hearing loss may not develop until the child is 2 or 3 years old. Chronic ear infections are very popular with any type of young child, any child of a young age. So to be able to pick up on a middle ear infection that could potentially impact a child's hearing temporarily is also very important.
So I know that you're not, an ENT, but with the kids that have these chronic ear infections, and a lot of them get tubes in their ears, can you explain that process?
Sure. So typically when a child has a middle ear infection, they have fluid behind their eardrum. So sound goes into the ear canal, which is the outer ear, but then it can't really get past the eardrum because of the fluid behind the eardrum in the middle ear space. So then what an ENT will do is typically surgically open up the eardrum with a tube. It's called a PE, or a pressure equalizing tube, essentially to open up that middle ear space, so whatever fluid or other material can come out and restore that middle ear space to how it's naturally supposed to be. But a hearing test is very important in that process as well, because first you want to see how that hopefully temporary ear infection is impacting the child's hearing, but then you also want to make sure after the child has the tube, did their hearing restore to normal limits?
Right.
You know, did the tubes work for both the pressure or possible infection, but also for the purpose of hearing?
Right. So apart from, doing your baseline testing, what are all of the things that sophisticated hearing addresses?
So we offer a baseline hearing test. We offer diagnostic hearing testing for individuals who do have hearing loss. We can test how they understand speech, both in quiet as well as speech and noise. And that's also a very important thing that not all offices do. It's relatively easy to hear in quiet conversations, but once there's background noise involved, sometimes the brain isn't as efficient as focusing on the speech or the target sentence that we're trying to listen to, and the background noise, the restaurant noise, that crying baby behind you is just too distracting that it prevents someone from focusing on speech. So it's important to understand not only how someone hears tones or pitches at different frequencies, but also how clearly they're able to understand speech, both in quiet as well as in background noise. And then for individuals who have tinnitus, sometimes pronounced tinnitus, or ringing or other noises in the ears, we do evaluations and also some management, sound therapy management for that as well.
All right, so let's go into that for a minute and talk to me about what are some of the causes of tinnitus. I pronounce it tinnitus, but go ahead.
Yeah, so tinnitus and tinnitus are both acceptable terms. Technically speaking, tinnitus is not an inflammation, which is what the suffix itis typically implies, which is why in the audiology field we prefer tinnitus, but both pronunciations are acceptable, so no problem there. There's many different reasons that someone can experience tinnitus. The most common reason is going to be noise exposure, so listening to loud music, working on construction sites, any kind of machinery noises. Musicians will often experience tinnitus because of that constant, loud exposure that they get to, playing music and other instrumentals. Hearing loss can be associated with tinnitus. When you do have hearing loss and your brain isn't hearing those sounds coming from the ear, sometimes the brain becomes hypersensitive or hyper attuned to listening for sounds that it doesn't hear or isn't receiving anymore, that it almost produces its own internal sound. But there's many things such as stress, head and neck pain, dental issues that can also cause tinnitus. Sometimes certain medications or combination of medications can cause tinnitus.
So I had a friend who had this very odd ear issue from eating too much salt. Tell us about that.
Yeah, there are certain ingredients, and it's different for everyone, but salt, caffeine, alcohol, excessive amounts of aspirin, they can all trigger tinnitus. Usually, or it can be a more short-term effect, but for people who experience episodes of tinnitus unexpectedly and repeatedly, sometimes keeping a journal of what you eat can lead to some signs as what might be triggering your tinnitus. So caffeine is definitely one of them. Chocolate can be one.
That's too bad.
And it's in excess. It's not just having one cup of coffee. It's having that fifth cup of coffee at a day because you're pulling an all-nighter or working on a huge project.
So there could be lack of sleep too.
Lack of sleep. You're producing stress on the body. You have some kind of accelerant or those energy drinks. A whole combination of that can cause someone to perceive tinnitus.
That is fascinating. Okay, so I have to confess, I listen, I have my AirPods in almost all the time. I'm listening to podcasts, I'm listening to music, books on, whatever, books on Audible. And my husband keeps telling me, you're going to lose your hearing. You better pull those out of your ears. So is he right?
It depends. If you're listening to them at a comfortable listening volume and it's not loud, then chances are it's not going to put you more at risk for noise-induced hearing loss because of noise exposure. But if you are listening to things at a loud sound, especially because it's so close to your eardrum and the auditory senses, listening to loud things for prolonged periods of time can put someone at risk for noise-induced hearing loss.
That makes sense.
So it really depends on the amount of time. And a lot of the technologies, including Apple products, they typically have some type of indicator or monitor that lets you know you're listening to something at a potentially dangerously loud level.
I noticed that a little notification came up on my phone recently, and I thought, wow, that's really helpful that they're telling me to tone it down a little. You
Exactly.
know? So the other question that I have for you, well, a couple of things. My mother-in-law, she's 85. She just got hearing aids for the first time, and she got them at Costco.
Okay.
And they tell her that they don't fit right because she produces too much wax. So I want to know the difference between getting a hearing aid at sophisticated hearing aids or sophisticated hearing versus those discount places. And then talk to me about, like how can hearing aids be made so they can fit better for people that have those issues?
Yeah, so there's a lot of different answers. At our office, we take into consideration the individual, not just their history, not just their audiogram or their hearing test, or their ear canals, but really the different environments that they're in. If they have any dexterity issues, if they have any, hand-eye coordination issues. There are certain hearing aids that are easier to put in your ears and others that can be more of a challenge. For people who have what we call retention difficulty, meaning the hearing aids aren't staying in your ears, I could be mistaken. I don't believe Costco does this, but we do offer custom ear molds.
See, this is what I'm saying. This is why it's worth it to go to sophisticated hearing, because you have all these specialty products that can do that, right?
Yes. So we can take impressions of someone's ears, send the impression to the hearing aid manufacturer or to an ear mold company, and then get the inside of what goes into the ear canal specifically for that person. And if for some reason they still have difficulty or it's not fitting right, there's some type of warranty on that custom product that makes sure that the manufacturer, myself, is going to make sure that it fits in the person's ear without any difficulty.
Right. So why are hearing aids so expensive?
There's a lot of research and development that goes into it from the manufacturer side. But typically speaking, when you see an audiologist or someone in private practice, you're also paying for the service.
Right.
So in our office, we have your first year of office visits are included in the purchase that you make with the hearing treatment. So you can come in as often as you need to, because if it's your first time with hearing aids, you might forget which is the right one, which is the left one. You might forget, what was I supposed to clean once a month, or do I have wax in my ears and that's making the hearing aid not function properly? Whereas if you go to Costco or somewhere else, they might, give you the treatment, give you the services, the testing, and then say, here you go, call us when you need something. I don't know what their protocols are, but that we definitely at Sophisticated Hearing really do pride on ourselves on giving the individual white glove service so that we get to know you. We get to know about your kids, your grandkids, your neighbors. Who are you going to dinner with, or what meetings are you going to where you're having difficulty? Tell me about that. Let's make some adjustments. Sometimes there's an app on your phone. If you're comfortable with, you can make adjustments in that setting. We can customize programs so that you can try 1, 2, or 3 in that particular environment.
Such personalized service.
And then you come back and give us feedback. You tell us what you liked, what you didn't like, and we come up with more solutions.
And this is why you've been in business for 2 decades.
Correct, yes.
I'm really proud of you. That's really amazing. Is there
appreciate
anything
that.
else that you think that our listeners would like to know about sophisticated hearing?
Yeah, so one of the things that we pride ourselves on is the importance of getting a hearing test regardless of your age. To answer your question from before, everyone should get their hearing tested every 5 to 10 years if you don't have any concerns.
Interesting. 5 to 10.
Approximately. There's no guideline, no rule of thumb, but that is really common sense. But once you start to get in your 50s, then it's recommended, speak to your primary care doctor. They typically have some screening questions that they can ask mask.
That's another question that I have for you. Do you accept insurance?
We do accept some insurance. So we recommend if you have insurance to let us know what insurance you have, and we can check to see if we're in network. Generally speaking, at least at this time, Medicare does not cover the cost of hearing aids unless there's a medical necessity.
Right.
So if someone has ringing in their ears, if someone had some kind of head injury or some kind of health condition that puts them at risk at hearing loss, and the doctor recommends and refers for a hearing test, they would cover. But as of now, to the best of my knowledge, if you want to check your hearing or you're interested in hearing aids, it's typically not a covered service for Medicare, but every insurance is different, every supplement is different. So we recommend people, check the insurance on your own to see what your benefit is and where you can go, but we can also check for you as well if you're interested in that.
So great. How many people do you have working at the office?
We have a total of 4 people, including myself. Wow. We have another audiologist, Dr. Donna Zabo. Annemarie is our patient care coordinator, so you'll see her when you walk in the office at the front desk. And then our director of operations or office manager is Dominic.
Great. Well, thank you again for being here. Before you leave, I want you to tell our listeners how they can reach out to you, what your phone number is, and so on and so forth.
Yeah, so you know our location on North Maple Avenue. We're right next to the Enterprise. Our phone number is 201-445-2455, and our website is sophisticatedhearing.com. Our motto is when you're ready to hear, we're ready to help. So we look forward to seeing you.
I love that. When you're
Thank
ready
you.
to hear, we're ready to help. Thank you so much for
My
being
pleasure.
here. We really enjoyed this enlightening conversation with Dr. Annemarie Olson, again, from Sophisticated Hearing. So whether you're navigating your own hearing journey or supporting someone you love, we hope this episode offered valuable insights and encouragement. And if you found today's discussion helpful, please share this episode with a friend. You can follow Ridgewood Talks on Facebook and Instagram, and please subscribe to the podcast on all the major platforms with full video episodes available on YouTube and Spotify. And by the way, this episode was produced by Gil Edwards of Ignite Creator Studios right here in Ridgewood. And for those of you who don't know, Ignite Creator Studios offers video podcasting and content strategy for businesses and services. So please give this platform a try and use the incredible resources here at Ignite Creator Studios. Thanks again to Dr. Olson for sharing her expertise, and to you, our listeners, for tuning in. Until next time, thanks for listening. Bye-bye.